an inflammatory disease caused when the immune system attacks its own tissues. Lupus, SLE, can affect the joints, skin, kidneys, blood cells, brain, heart, and lungs. The most common signs and symptoms include fatigue, fever, joint pain, stiffness, and swelling, butterfly-shaped rash on the face that covers the cheeks and bridge of the nose or rashes elsewhere on the body, skin lesions that appear or worsen with sun exposure, fingers and toes that turn white or blue when exposed to cold or during stressful periods, shortness of breath, chest pain, dry eyes, headaches, confusion, and memory loss. Complications. Inflammation caused by lupus can affect many areas of your body, including your kidneys. Lupus can cause serious kidney damage, and kidney failure is one of the leading causes of death among people with lupus. Brain and central nervous system. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes, vision problems, and even strokes or seizures. Many people with lupus experience memory problems and may have difficulty expressing their thoughts. Blood and blood vessels. Lupus may lead to blood problems, including a reduced number of healthy red blood cells, anemia, and an increased risk of bleeding or blood clotting. It can also cause inflammation of the blood vessels. Lungs. Having lupus increases your chances of developing an inflammation of the chest cavity lining, which can make breathing painful. Bleeding into lungs and pneumonia also are possible. Heart. Lupus can cause inflammation of your heart muscle, your arteries, or heart membrane. The risk of cardiovascular disease and heart attacks increases greatly as well. How do you know lupus is affecting your heart? Yes, some people with lupus develop pericarditis, fluid around the heart, during a flare. The symptoms are sharp chest pain with breathing and a shortness of breath. The treatment is usually non-steroidal medications, such as ibuprofen and naproxen, or short-course. Hernia occurs when an organ or tissue pushes through a weakness or opening in the muscle or tissue that normally contains it. This often results in a bulge or lump and can cause pain or discomfort. Hernias are generally caused by a combination of pressure and weakness in the surrounding muscle or tissue. Here's a more detailed breakdown. 1. What happens? A hernia develops when the inner lining of the abdomen, peritoneum, weakens or has a tear. This allows abdominal organs or tissues, like the intestines, to push through the weak spot, creating a bulge. The bulge may be visible or palpable, especially when standing or straining. In some cases, the bulge can be pushed back into place, but it may reappear with pressure or strain, a condition in which the appendix becomes inflamed and filled with pus, causing pain. The appendix is a pouch on the colon that has no known purpose. Appendicitis begins with pain near the belly button and then moves to the right side. This is often accompanied by nausea, vomiting, poor appetite, fever, and chills. Appendicitis is usually treated with surgery and antibiotics. If untreated, the appendix can rupture and cause an abscess or systemic infection, sepsis.